Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Hello. Today I would like to speak to you about Brella. Brella is a new FDA-approved, in-office, non-invasive treatment to reduce sweating of the armpits, otherwise known as hyperhidrosis. Hyperhidrosis is a general term that means hyper, a lot, hydrosis, sweat, a lot of sweat, and it can refer to other areas of the body. People can get hyperhidrosis of their palms, their soles, their scalp, their armpits. Brella is specifically for the armpits, which is the most common area that patients complain about who have hyperhidrosis. Now, some people who don't have this condition would diminish it as not as important as other medical conditions, but for the people who suffer from this condition, it can be very debilitating. They are constantly sweating. They are worried about body odor. They're embarrassed about their dripping sweat. They curtail social events due to their dripping sweat. It's hard for them to work out in public due to the dripping sweat. And they do have to limit different things that they can wear due to their constant wet armpit stains. So it is a real issue for many people. Up until now, we did have a few good treatments for hyperhidrosis of the armpits. Briefly, they were Drysol, or high-concentration topical aluminum chloride, Qbrexza, which is another prescription topical that comes in pads to wipe on the armpits, Botox injections, which are FDA-approved for armpit hyperhidrosis, which work incredibly well, but are very expensive and require needles, which bother some people, as well as more aggressive treatments such as Miradry or surgeries to cut particular nerves, which reduce sweating. Now we have Brella, which is a salt patch that we apply to the armpit in the office, and the sodium in the patch reacts with the water in the sweat gland and temporarily damages the sweat gland, thereby reducing sweating. As of right now, it is only FDA approved for the armpits. Let's discuss what an office visit for a Brella treatment looks like. First, we need the armpit shaved but not irritated, so we ask both men and women to shave the hair off if they have any hair 2 to 3 days in advance. Then, we need the patient to be able to sweat for the treatment to work, so we ask them to come to the office with no deodorant and no antiperspirant on that day. In the office, we clean their armpits, and we apply the Brella patch to the affected area. We massage it and discuss with the patient if they are feeling any tingling or discomfort. This is normal, to have tingling and discomfort. Usually within a few minutes, the discomfort is increasing, and we try to get the patient to tolerate it to about a 7 out of 10 if 10 is the worst pain, and then we remove it. Once it's removed, we neutralize the patch in a special container, and we apply water to the patient's armpit. It feels better right away. Usually, patients are able to keep the patch on from anywhere between 1 and 9 minutes on average. Different patients will keep it on for different amounts of time, and sometimes even it will vary from armpit to armpit. Most patients will see a significant reduction in their sweating within a day to a week or so. The results of the reduced sweating typically last about 3 to 4 months on average. We will have the patient book an appointment for 3 months or so, but if they are not sweating at that time with their appointment coming up, we ask them to call in advance and reschedule, as the patient needs to be able to sweat a bit for the treatment to work. The entire treatment takes about 15 to 20 minutes, and we always in our office ask patients to allow an hour to an hour and a half or so from beginning to end of their time in our office, because there are consents to be signed, photos to be taken, etc., but the actual treatment is less than 20 minutes. So, what are the side effects of Brella? Mostly it's a burn, because the Brella treatment causes thermal injury. It creates heat. and it is possible to burn the skin, especially if areas of the skin are irritated, which is why we ask people to shave in advance and not right before. If the patient gets a superficial burn, it usually heals pretty quickly, and permanent scarring has not been reported at this time, but that is the main risk, a burn and irritation. If the patient gets a burn, it can be treated easily with typical first aid, and if that does happen, we will closely monitor the patient and the healing to reduce any risk of scarring. So in summary, Brella is a great new addition to our arsenal of treatments for hyperhidrosis of the armpits, and we are so excited to be able to offer this to our patients. It's a life changer for so many people. It's a new FDA-approved treatment for hyperhidrosis. It's done in an easy office visit. It does cause a bit of discomfort, but it's quick. The discomfort goes away fast. For someone who has been suffering from hyperhidrosis, they have typically tried all the other treatments, and the main advantage to Brella is that it is less expensive and less invasive than Botox, and the side effects are pretty minimal. The main side effect is a superficial skin burn and irritation. If you are interested in Brella, call our office or another board-certified dermatologist near you to see if Brella is available. It's on a slow rollout. It is a new treatment, so it may take a number of months until it's readily available everywhere. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.